Already joining. We just started the recording. Perfect. So let's kick off and people can join us as we go along. And as I just said, it's being recorded, so please do feel that you can watch this back at any time. And if you aren't able to make it, then please, I'm glad that you can watch it in the future. So I'm Dr. Claire Petros. I am with Dr. Max Polyak. I have the wonderful job of doing a whistle-stop tour of our journey as the Ridley Project sea turtle medicine journey from 2016 all the way up until today. So I'm going to try and do as best I can to acknowledge everyone and all parties that have been involved in our wonderful adventure of sea turtle medicine in the Maldives. And I will then hand over to Dr. Max, who will give us a broad and in-depth the detail of our clinical medicine and what we are currently doing, and also what we hope to achieve moving forward to the next 7 years. So can everyone hear me okay? Is everyone happy? We'll kick off. Right. So I'm going to start at the very beginning and say that it was definitely a wonderful adventure to be part of, to come out to the Maldives in 2016. And it was actually following a Facebook advert that Dr. Martin Stelfox had posted saying sea turtle vet in the Maldives wanted. As you can imagine, for any young vet, it was sort of the dream job, both the location and also the animal to work with. And after having done a lot of research as to where I was going and seeing this beautiful island, we realised quite quickly why it was so desperately needed, the rescue centre at the Ridley Project's Marine Turtle Centre at Coco Palm, Dunikolu. So this is the island that we are currently situated on. Martin found that there had been many sea turtles during his time as a marine biologist found floating entangled in fishing nets, entangled in ghost nets. And unfortunately, at the time in the Maldives, there was no veterinary facility that was able to care for these animals and provide them with the medical treatment that they needed. So his dream was to open a rescue centre where there'd be a veterinary-led centre where turtles can come and be treated and released. So the partnership actually happened earlier than 2017 with Coco Palm, so the Coco Collection. And it was the first resort that we partnered with, which were giving us, it was a huge gamble on their part to basically host a veterinary centre on the island with their guests and the tourists. So we were spending quite a bit of time initially. I arrived in November 2016 just to get the tanks off the ground, and the engineering department were incredible at Coco Palm. They designed the tanks, the plumbing, the electrics, and they were multi-functioning, fully functioning tanks, as you can see there in the right photo. Deep, they were 2 meters deep, and we were really impressed with everything that got put together in time for the opening in February 2017. So we had this tank and we had the space. We had only $500 initially to set up the actual veterinary clinic itself. So that was one of the first big hurdles that we faced. But the biggest hurdle actually was to register as a vet in the country and also to register for our medicines, our controlled drugs. So after many meetings and partnerships with the Ministry of Environment, with the EPA, the Environmental Protection Agency, the Ministry of Health, the Ministry of Agriculture and Fisheries, the Ministry of Medicines and Drugs, we had to form all of these partnerships to get off the ground so that we were able to efficiently treat our first patients. So even though we opened in February 2017, it took quite a few months during that first year to actually establish ourselves with a fully functioning clinic. The next thing, obviously, that we then wanted to achieve once we had our medical centre set up and our patients were coming in was to show it and share it with the world. So we started our school trips in 2017. And we also started our Maldivian intern project, because obviously at the time there was just one vet on the island and we needed extra support and extra help with the procedures and also with our patient care. Now, the volunteer program was also a really big part of our work still today. In fact, it's grown since, and that helps us fund the medicines and provide the care that we do to our patients. And we were really also interested in making sure that we could share it with the local communities, especially starting with the schools nearest us in Bar Atoll. So we started opening up the centre with the support of Coco Palm to local children in the Maldives. And then as we grew and we started sort of showcasing the rescue centre, we were getting calls from all over the Maldives. That's 175 kilometres from north to south of turtles that were being found entangled in ghost nets. So we needed to get them to the rescue centre. And now, as many of you know that have been to the Maldives, the easiest way to get from any resort to another island is with the Trans-Maldivian Airways. So we actually partnered with them, and they actually will transport our sea turtle patients for free if we can get them to any island that has a seaplane terminal. And since then, we've also partnered with domestic airlines like Manta Air, for example. And most resorts in the Maldives have been very generous at sending our patients via speedboat to us. So we really couldn't have got the patients without many different people helping us and getting them to the island. Now, the next couple of years, we wanted to grow medically as a clinic. We started off, like I said, with $500, and we wanted to expand the equipment that we were able to give to our patients to make sure they had the best possible care. We also started a visiting vet program to get other experts in the field to come and actually train our members of staff and make sure we were providing up-to-date medical treatment for our patients. And we also started our first expedition, so traveling the Maldives on our research boats. And on top of that, we then started partnering with other resorts as we realized one of the biggest issues that we had was space. As we became well known, we got more patients, and our tanks, even though we had seven of them at Coco Palm, were not sufficient to hold all of our patients. And importantly, the outreach was also a big part of our world at that point. And we started and initiated the first Vivoshi Olive Ridley Turtle Festival. And as well as that, in 2019, Coco Collection actually advertised our volunteer program as the best internship in the world. And we got like world reclaimed of our centre and of what we were doing in the Maldives. So it really helped increase the number of supporters and followers that we had. So the outreach and education, that middle photo is one of the expeditions where we started to teach, go to local schools and explain what we were doing at the rescue centre. And the Vivoshi Festival that was run by one of our resident vets at the time, Dr. Claire Petros, was held locally in Bar Atoll. And it really started the initiation of getting as much knowledge about sea turtles spread across the Maldives as possible. Now, this is an example, just a few photos really to explain how we went about starting from very small means as a veterinary clinic to now what we are today. So we really did push, obviously, our social media. We loved doing live talks. Dr. Minnie was very good during lockdown at starting the live feedings on a Sunday, which I hope many of you still watch. And if not, please do tune in every Sunday to our patient live feeding. We also were very grateful to the guests at Coco Palm, as our intern and volunteers there are seen making ghost net bracelets. So with the nets that the turtles were entangled in themselves, we would then reuse and make into ghost net bracelets and sell them to get donations to cover the cost of our medications at the rescue centre. Now, we also would, provide feedback to our guests. Our guests are able to come and see our turtles throughout the day. And we also have Turtle Kids Club. So when there are children on the island, we try to inspire them with the veterinary team as to how we treat our patients. And then finally, with the visiting vet program that started in 2018, as I said, we have many experts in different fields of veterinary medicine that might be able to provide some more insight as to how best treat our patients. And one of the particular vets that came in 2021 actually produced a little media video that went viral on the Dodo. So it was another way to sort of broadcast the work that we were doing, get more like media attention, which also has helped over the years with donations and partnerships. And that's with partnerships such as like Fourth Element that are making our wonderful t-shirts, another dive company that is inspirational for kind of having plastic-free products, Legend bracelets as well, have managed to get us like seen on a wider scale globally and helped support us by providing us with like electrical equipment to actually help us at the rescue centre itself. Now, moving forward, we still found that we were having more patients than we could even have, especially type patients that needed a longer time to rehabilitate at the rescue centre. And several other resorts were beginning to become interested in offering us space to have some tanks. So over the couple of next years, we then partnered with Sunivajani and Jawali to have some more rehabilitation tanks. And we also realised that we're having seen so many patients, at this point we were tipping over 100 patients within the first 4.5 years, that we needed a patient management software. So we partnered with an international international NGO that was providing us with ProVet, a way to keep our patients, and it enabled our veterinary team to stay on top of our patients' treatments. And we also started some online funding donation projects, such as the satellite tag campaign, the tag which we'll talk about very shortly. So we wanted to keep up with the number of patients that we had, which required more partnerships with resorts and more specified tanks to keep our patients after they've been treated by the veterinary team. So we had these wonderful examples of tanks that we now will have to treat our patients moving forward. In North Malé, Ra and Nun atolls. Because you can imagine, as mentioned earlier, these turtle patients come from all over the Maldives. So it's really important as well just to have them as housing tanks for overnight before they can get to the rescue centre to make sure that they're well treated. And here is Autumn, our first satellite tagged patients, turtle track. And that was honestly only achieved because of the number of world donations that we had from some of the first original supporters of the project before we'd even set off in 2017. And since then, we've had many donations specifically so that we can help track our turtles. And as veterinarians, it's very important for us to know how well they do, especially after they've had perhaps a flipper amputation, once we've released them, to see if they can actually survive well in the wild and show their normal behaviours. So this is a really exciting program that we've started that will continue on in the future. And on top of this, we have one very exciting new position that only started last year, which is the first veterinary nurse position in the Maldives. Lauren, who was our first veterinary nurse, came to us, and we were really proud to have started this new position, because it's very important to have a full veterinary team, as it shows that the vet alone cannot run a clinic, and it also gives new insight into how clinics can be run and how they can be organised, and really gives an extra perspective of the veterinary team on a global scale with us at the veterinary centre. And we've also expanded further, and we've started some more international collaborations with the rescue centre itself. So we're even trialling new satellite tags that will be cheaper to create, cheaper to buy. So hopefully more patients can be treated around the world with this programme. We've also had another collaboration using drones with another NGO similar to ours that are interested in having rescue centres. So with the veterinary programme officer role, we'll also be expanding to help set up new rescue centres around the world, for example, hopefully in the near future in Cape Verde. So as we continue to grow, we continue to find ways to expand our knowledge and share it with the world. So just as a little insight quickly of our clinic and how it's progressed over the years. As I mentioned, that $500 that we started off with very limited funding really to get the clinic off the ground. Many equipment was sort of donated. I think the Doppler came from the UK originally, for example. But over the years, as the guests have been wonderfully generous, and so has the public, since we've increased our social media presence, the resort itself allowing us to host in the resort. So the clinic on the left, from 2017 to 2018 had a drastic improvement. And then really excitingly this year, we've actually expanded to 2 rooms because we have so much equipment that we needed more space at Coco Palm. And Ocean Care, which is one of our first supporters, have given us many pieces of equipment over the years, which Max will discuss more about how we use them. And without them, we wouldn't be able to provide the best care that we try to do at the clinic. So as I mentioned earlier, the team has really expanded from one veterinary surgeon on the island to having a lead veterinary surgeon who can take care of the team remotely and discuss any clinical cases that are required. And now we have the new position of the veterinary nurse as well, and the veterinary program officer, which can help expand our veterinary advice and help around the world. And of course, we have our Maldivian intern that is there as a key and crucial member of our team. Not to mention the volunteer places that without that wouldn't really be able to help support how we can fund the clinical costs of treating our patients. So we now have expanded to 3 volunteer places. So if you're interested to come and join our rescue team and see the work that we do on the island, that's something that you're able to do with us between 2 and 4 weeks. And we also have these visiting vet placements that have, like I said, experts that can come and work with us as part of the team, but also we're now really involved with training turtle vets or future turtle vets, but I'll leave that to Max to discuss further. So the medical equipment journey itself is actually a very interesting part of us. As you may be aware, veterinary equipment or any medical equipment is exceptionally expensive. And so it was things that we really wanted to save up for to make sure that we could provide and bring to the rescue centre. We've been exceptionally fortunate that over the years of doing so much outreach, we were actually donated our first digital X-ray machine from the UK. And that was an interesting story in itself, as it had to be flown over and then get a boat to the island. And it turns out that seawater and any electrical equipment is not very a good mix. And so we've had very amazing support from the companies themselves to actually supply us with more equipment when needed. And it's been a bit of a struggle to get some of this equipment to this remote island. We've also had guests that have visited the centre and been amazed by the sort of work that we do, and even offered to support buying a new endoscope for the clinic too. That was a human medic guest that wanted to share that. So we're very grateful to families that want to support us in that way. And again, like I said, Ocean Care from the very beginning have been very generous with being able to provide us with the funds to buy the equipment that we really wanted. But like I said, I'm going to hand over to Dr. Max to discuss how we use that equipment and why it's so important that we have this at our veterinary centre to treat our patients. So thank you very much for listening for our introduction, and I'll hand over to Dr. Max.
Thank you, Claire. I'm hoping you can see me and my screen in this. Okay. Well, welcome everyone. And I'm going to pick up from where Claire left off and give you a little bit more of where we hope to go with sea turtle medicine in the Maldives and with the Olive Ridley project. I can figure this out. Okay, now we're on the right track. As Claire mentioned, the reason we can do what we can do is because of the generosity of donors and of the effort and vision of the leadership in the charity and everyone involved with sea turtle conservation in the country. And that's reflected in the equipment we have now, which is available to us to both diagnose and provide therapy, all very cutting edge in terms of not just sea turtle medicine, but medicine in general. So we have a digital radiography system, which is really the gold standard in X-ray machines, if you will. And it's a critical component in diagnosing injuries and disease in our patients. We also have a full clinical chemistry platform that is featured up here on the left that is being deployed actually as we speak in the Maldives. It's quite an effort to get it over there, but this is a full blood machine that can test really all of the biochemical parameters that one would test, not just in veterinary species, but in humans too. So we're really fortunate to be able to have that type of machine to access and use for diagnostics in our patient population. As Dr. Claire mentioned, we have endoscopy and ultrasound. So these are great tools, again, for diagnosing and for providing specialized therapies. We just also acquired this year a class 4 laser, a very specific kind of class 4 laser has been validated in these species. And that's important, just like the clinical chemistry machine, that the equipment that we use, it needs to work in our very specialized patient population, which are sea turtles. They have different skin, they have different tissues and things like that. So finding the right equipment to work in our context is a challenge. And so we're very lucky to be able to have first identify these units and these pieces of equipment and have been able to deploy them for our patient care. And then, of course, one of the mainstays of medical therapy, surgical therapy, is surgery, and we do that on a very routine basis. So you saw from Dr. Claire kind of where everything began in that little room with that single table and just a few items, but the job could get done in that capacity, and done well. And then you saw how we've grown from not just the rescue center at Coco Palm, but also with the addition of rehabilitation centers at 3 other resorts to serve 3 other atolls. So now we have 14 tanks that we can provide for patient care, and so that's a really large number, and we're very, very grateful for that. So from this point forward, where do we want to be? What's our vision? And our collective vision is really to become the Sea Turtle University, that model. And when you hear the word university, most people will think, okay, I have an idea of what that is. It's like a teaching hospital. It's a place that does a lot of research, and it's a place that teaches and instructs the sort of the next generation. And that's all of those things are what we have existing and what we are cultivating and developing into much further depth. All of those components of this university model, which I'm going to share with you right now. So what species do we see? We typically see olive ridleys. I mean, Dr. Claire talked a little bit about how the charity was founded, and it's in large part because these species are seen in these waters. Now, they're not native to these waters. There's a big difference, meaning that they're not reef-bound animals to the reefs in the Maldives, but they do get caught up in drifting marine debris. And the weather patterns in this part of the world push this debris across the Maldives. And so these animals, and it's not just sea turtles, all marine fauna are caught up in ghost gear and marine debris. And so we see these species in this capacity. They're injured and diseased as a result of this type of entrapment. So it provides, and then we also have hawksbills and greens to a much lesser extent. Those are more classically reef-bound species. But the important thing about the olive ridley component, which is about 85% of our patient census, is that there's really no other place in the world where you can treat and study olive ridley sea turtles in a hospitalized setting. So it gives us a very unique window into this kind of enigmatic species that we don't know very much about in the sea turtle conservation world. We have selected in-depth studies on, for example, nesting and reproductive behavior and things like that, but not animals that are opportunistically found injured. And so we have a great opportunity to learn and to share about these species in this capacity. Now, what do we see in terms of presenting conditions? Well, I have here 2 major ones: entanglement, which I kind of alluded to already, and then a condition called buoyancy disorder. And buoyancy disorder is exactly kind of what it sounds like. It's the inappropriate floating of a sea turtle in the ocean. It's an animal that's at the surface that cannot dive, it cannot feed, it cannot perform normal behavior as a sea turtle. The other feature there is head trauma, things like that, small things we see, but not in a very frequent way. But entanglement and buoyancy disorder, even though I've separated them out, they really are very linked, because most animals that get entangled have a component of buoyancy syndrome. And most animals that are floating inappropriately are likely going to be interacting with surface debris. So I kind of, and as their doctors, we kind of look at it as one giant syndrome. But I'm going to talk about each one of these individually and how we treat them and how we treat them differently, with the ultimate goal to release them back home to the wild. But in that period of time that they're in our care, we want to learn the most we can about them. Okay, so let's start with entanglements. So entanglements, the standard of care is really, it's fairly basic. And this goes with a lot of veterinary species. You get entangled in something, it's usually what's called the appendicular skeleton, so your limbs and things like that. You treat that tissue with some surgery, some wound therapy, and then if that limb is not viable, you surgically remove it. And that happens, it's a fairly straightforward process, and it happens everywhere. But we felt like we can do better than that. And certainly with the technology that's available today and the resources we have now as a growing effort within our charity, we can do better. And so what we've developed is a limb salvaging protocol that includes cellular, molecular, sort of precision-based medicine to attack this issue, which is not going away. Entanglement is going to be a feature in sea turtle medicine always. So we want to return to the wild our patients with as much intact limb as possible, because that will ensure their greatest chance at success in the wild. So anything we can do to accomplish that is a win, and that's why we have developed this limb salvaging protocol. So what is that protocol? Well, here is a kind of a busy slide, but it really captures all of the components of the limb salvaging protocol. So laser therapy, that class 4 photobiomodulation that I was talking to about a couple of slides ago, this is it. This is what it looks like in practice, okay? It's non-invasive. It provides a wavelength. Actually, it provides 9 different wavelengths simultaneously that are known to improve healing by a number of different processes. I won't get into it right now, but it accelerates healing in a remarkable fashion. Other class 4 lasers provide 3 wavelengths. This one provides 9. So we're very lucky to have this, especially with the patient population we have. Remember, they have very thick skin, their tissue is different, and so forth. This also provides pain relief. And so in addition to the healing that's accelerated, we can provide some relief of discomfort for our patients without having to give them a medicine. And so that's another added benefit of the laser therapy. It's very important in limb salvage. Into the molecular and precision-based side of things, stem cell therapy. So we can do this now. And, you know, people very often say, I can't, you know, I've never heard, first of all, of a sea turtle hospital, but secondly, that you can do a stem cell therapy with sea turtles, and you can do it successfully. And there are many indications for it. In this context, we use it for limb salvaging. And in a process that we developed, we take tissue from that same animal from a different spot. And it's usually like a little piece of fat. It's a very small surgery. That little piece of fat is then processed so that the very few stem cells that are in that little chunk of fat can be expanded in a safe and sterile fashion. Meaning, when I say expanded, then meaning we grow them in like a culture. And then after a number of days, say a couple of weeks in sea turtles, we could take that cell growth, stem cell growth, and we can inject it back into our patient to achieve all of the great benefits of stem cell therapy, which are accelerated healing, which is actually, stem cells are wonderful because they do things for your patient, even if you are not aware that there's a need for it. If there's an injury that's kind of hidden or a disease process that's hidden, the stem cells can fix that. In addition to what you are intending to fix in the first place, in this case, an injury. Down in the middle here on the bottom, platelet-rich plasma, we have also initiated this with our patients this year. And so that's what it looks like. In that syringe, that's what platelet-rich plasma looks like. It's this beautiful golden hue. But what it is a concentrated, processed component of whole blood. So blood is removed from our patient, and it's processed in a certain way, and we add some compounds to what's called activate the very good parts of the plasma, the parts that are known to promote healing and to minimize inflammation and things like that. And so once that processing is completed, and that only takes several minutes, it's not 2 weeks like stem cells, we re-inject that back into the wound. And that also provides an amazing modality to enhance our healing. acupuncture. We practice a lot of what's called integrative medicine, and this is a component of integrative medicine. Now, what you see here is our dry needles, and dry needles that are hypodermic needles, not like the classic acupuncture needles that you would see in other veterinary species, or if you get acupuncture treatment yourself. The reason why we use these needles is because, again, their skin is so very thick that traditional needle gauges for acupuncture couldn't penetrate them. But more importantly, what we use is a version of acupuncture, which is called aquapuncture. And instead of leaving a dry needle, or in this case, a hypodermic needle in the spot of the acupuncture point, we introduce a very tiny bleb of vitamin B12 in that spot. And so that we do that for a couple of reasons. One, in traditional dry needling, you have your patient out of the tank for quite a long time. 20 minutes, sometimes 30 minutes. That's too long. It's not necessary, because you can get the same benefit, and arguably even better, if you introduce that little vitamin B12 drop into the same site. And then that just takes a minute or so, and then you can return your patient back to their tank, which is like their hospital bed, to make the analogy for humans. You try to minimize the time out of water for these species, especially when they're in the process of healing from a condition. And then finally, we have surgery. This is a picture here of Dr. Mariana, who's our current resident veterinarian, doing what's called a surgical debridement. And that's a procedure where we surgically manipulate the wound in a series of procedures over time to shape the healing in a way that we hope will, maintain the integrity of that limb and maintain its function and provide the best sort of seeding and bed area for healthy tissue to form after being treated with all of these other modalities. Okay, so most of the time we are using nearly all of these for every patient that requires it in this limb salvaging protocol. The rarest one used is stem cell therapy, but still the other ones we use very, very regularly. And so it's a very well-honed process that we have. And I'll show you an example of what an outcome can be. So this is a juvenile here, a juvenile green sea turtle, Chelonia mitis. And you can see this is the presenting injury. So this is the elbow, basically, of the right elbow of this little guy. This is a really bad injury. All right, you can see bone here I'm trying not to introduce a kind of gross picture, but this is what it looks like. There's really not much tissue left. The joint itself is completely open, and in medical terms, that's a very bad thing. Joints have a capsule around them, and there's a reason for that. So when that's exposed, the joint that is, it's a very, very bad thing. It's a very bad prognosis for this limb. So if any veterinary surgeon amputated this limb, it would be a perfectly reasonable decision. I mean, 9.9 times out of 10, absolutely. But we decided to adopt this limb salvaging protocol to this limb and see what happens. So all of the things that I discussed on the previous slide, we applied to this little guy's limb, including the aquapuncture here. And this is kind of how the wound was about halfway through his rehabilitation and therapeutic time with us. And this is it at the end. I mean, it's not pretty, but it was absolutely healed and absolutely functional. So what was returned to this limb was about 85% of range of motion. And that's a good thing, because sea turtles utilize their front flippers, most importantly, of all of the flippers, the front ones, for locomotion and for propulsion. So to engage in normal biological behavior, but also to evade predators and so forth. So returning function and range of motion to the front flippers is really, really, really important. So we were able to do that with this guy and very many other patients subsequent to this one. So the next big disease category, so to speak, that we see is Boonsey disorder. And this is a problem around the world too. This is a big problem. There are a lot of turtles that are in kind of permanent captivity and are deemed non-releasable because they are floating and there isn't a way to fix them. But we kind of differ from that position. We believe that there's a way to fix nearly all of the types of buoyancy disorders that we come across. And so in that paradigm, we put together this really comprehensive approach that includes 6 features that can be used individually or can be used collectively to address a buoyancy problem in a particular patient. And that all depends on the severity of the buoyancy and the clinical status and so forth. But just very basic, from a very basic point of view, there are really 2 ways that air is stuck inside a sea turtle and therefore causes buoyancy. One is from the lungs, one is from the gastrointestinal tract, and the other, there could be trauma that's related to both of those 2 where this can happen. But I just want to keep it quite simple so you can get it conceptually. And so what you see here in this little video here, I'll play this again. This is a juvenile hawksbill, and this is a CAT scan. Okay, so we have a really pretty image, and that's why we can float it around and all of this and make this 3D kind of thing. So what you see here is the whiteness are structures with air in it. So this is his trachea, so the tube that he breathes through, just like we do. They're air-breathing animals, just like us. So the lungs look very much like ours as well, except they don't have specific lobes, but very much like ours. So you're supposed to have air in the lungs, but what you're not supposed to have is air in other places, and that's what these other white dots are. So that's air in his intestinal tract. And so this little guy was floating inappropriately. So buoyancy disorder can attack, so to speak, young animals at a very early life stage, as well as subadults all the way into adulthood. So it doesn't discriminate. It can affect any animal. So this is an example of gas that's inappropriately collecting in the intestinal tract. This here is another image of lungs of a sea turtle. And the bright white is disease, is pneumonia, severe pneumonia. This is a really, really, really bad case. Normal tissue looks like this. So this white area won't ever return back to normal function. It will die, and it will kind of what's called fibrose. It will turn into like a scar tissue. But there's enough of normal tissue for this animal to survive. And in fact, it did survive and was released. But my point in telling you this is, in showing you this image, is that the lung disease can also cause buoyancy. And we'll see how we treat all of this. So these are the 6 things. Okay, targeted external weight therapy, I'll talk about that. Nebulization, I'm not going to get into that. Centesis, I'll talk about. Sea cage, we're not going to talk about, but blood patches and surgical implants. So some of these I'm going to talk about more in depth. The other ones, not so much, just for time purposes. So this is targeted external weight therapy. All right, so this is this little guy we just saw. This is just a static picture of what was going wrong here. This is actually him. So targeted external weight therapy is exactly what it sounds like. We place different sized weights very, very specifically in locations on the animal, most typically on the carapace, which is the top shell, with the intent to slowly correct the abnormal swimming patterns. Okay, so the challenge with buoyancy disorder in treating it is twofold. One, you have a functional problem. You have gas inside the animal that shouldn't be there. And then 2, because that animal has been swimming with gas inside it in an abnormal fashion for such a long time, and sometimes it can be months that they're stuck in these nets, they learn a new swimming pattern, swimming behavior, which is abnormal. So the abnormal swimming behavior becomes their new normal. And so we have to kind of teach them to relearn how to swim normally again, how to dive, how to surface, etc. Once the gas is removed from them, from their body cavity, which is called the coelomic cavity. So one behavior. So it can be very challenging because each animal is its own individual. It has its own personality. It learns in different ways and so forth. And so we have to be like kind of like sea turtle whisperers in a way, in applying psychological tactics to in addition to therapy to get them to swim normally again. So targeted external weight therapy is a really, really, really important part of our practice. It's got to be done exceedingly carefully. If you just slap a weight on an animal, you're going to cause a new pathology, a new abnormal behavior, which is going to be very hard to correct. So we do this very, very, very carefully, okay? Now, here's a few videos of an adult, Olive Ridley, which has buoyancy disorder. So this first video here, you see how she's trying to kind of swim down, but she can't. Her tail end is is pointing upwards at the surface, and she can't get down, okay? So we started her on targeted external weight therapy, and after a few weeks, you have this middle video. So you see her now, she's under the water, but it's not really normal swimming. You can kind of see she still pops up a little bit, but the weight you can see on her, all right? And again, it's a very specific weight size in a very specific location. These scratches you see on her is resolving trauma from being stuck in a ghost net, okay? And then at the end of it, this is what you see. So the weight's still on her, but she's able to hang out at the bottom, okay? And she's just resting, and they like to be under these features and so forth. So this is kind of a very quick progression of what I'm talking about, all right? With using targeted external weight therapy. A really great thing that we love doing. It's kind of very simple in concept, but very challenging in practice. And again, the reason we do it is to assist with the functional component of this disease process, but also change the behavior of the animal so that it can relearn to swim again. The subtlety here is that it's not the front flippers that are really doing the new kind of swimming. It's how this animal takes gas into their lungs and exhales that gas. That is what mediates the diving and surfacing of sea turtles. They're exquisitely refined at being able to inhale and exhale just the right amount of gas to get them to where they need to be. And those of you that scuba dive and so forth, or even just free dive, you will understand this very, very well. If you breathe, take a breath that's the wrong size, your body will perform differently in the water. Okay. Another thing we can do are syntheses. So a synthesis is just the removal of something from a hollow structure, okay? And so in this case, we are removing gas from the body cavity, which is called the coelomic cavity. And this is Dr. Mariana, and this is Lauren, our first veterinary nurse, and Julian, who is one of our sea turtle biologists who was doing his training with us for a little bit. So this is how it looks, okay? So the veterinarian is placing a needle under ultrasound guidance into a very specific location and slowly removing some of the gas. And we do this selectively because you can remove too much gas and you can cause even more problems. So this is a very, very delicate procedure too, and it's done under really controlled conditions and so forth. But this is the general concept. And this is removing gas from the coelomic cavity. So it's called the coelomocentesis. The reason, and there are two kinds that we use. One is coelomic, and then the other is enteric, meaning from the GI tract. So the coelomocentesis is usually performed because the animal has tears in its lungs, and gas is escaping from its lungs into its body cavity. Okay, I'll get into that a little bit later. The enterocentesis, so gas that's in the GI tract, is depicted here. So again, the same concept. You have this turtle on the side, about a 75-degree angle. This arrow depicts where the needle goes, and again, it's under ultrasound guidance. And so this is a contrast X-ray radiograph of a patient that had, this is how it started. So all these big white things here, this is intestines filled with gas, all these white loops. That's not normal, okay? So after this synthesis, you can see that most of it has been reduced. You can't get all of it out, and you don't want to. You want to do it in stages. But you can see how different this image looks from this. And this is just several minutes after. All right. So that's how quickly this can happen. It's it's a very effective procedure, especially with gas that's in the GI tract. Okay. How are we doing on time? All right. Buoyancy disorder, we do blood patches. Okay. So this is a little bit of a busy slide too. So a blood patch is really a way to use blood, which is the best for healing anything actually, and placing it into a location where it's needed. And in this case, a tear on the lungs. So how do you do that in the sea turtle? Well, it's not easy, okay? So what I'm showing you here, this is a very quick view of using an endoscope to go down the trachea, which is the air pipe, so to speak, into the lung, to the location of the tear, which is where this arrow, so let me slow this down. So this is going down the trachea, down the trachea, and this looks pretty much how it would look actually anatomically, even though this is reconstructed. And then it bifurcates, so it goes to two lungs, into main stem bronchi, which is what they're called. So I go into the one lung, I know where the hole is, I have to repair, and then these finer structures is where damage is. And so imagine that my endoscope, which is basically an instrument that's a really long tube, and this is a bronchoscopy, you may have heard this procedure. It's a really long tube, and inside that tube is a camera and a light and some other things that can push fluid and air, and I can grab structures and things like that. It's a really cool medical device. So I go down, look inside the lung, find where I need to put blood to repair this tear, okay? And this arrow here depicts where I would insert a very long needle from the side of the patient to inject the blood, okay? And this is what it looks like in real life, okay? That previous picture that was really fast, this is the actual tear that's inside here, and that's where the blood will go, through this arrow, through this needle, all right? So why do they have tears in their lungs? How did they get that? How does it cause this? The reason they have tears in their lungs is because when they're trapped in marine debris and they cannot surface, their response is to use their front flippers and flap them violently under the water to get to that surface, to get that breath. And the way the muscles of the front flippers are attached inside the body cavity are such that in these species, that type of violent flapping and violent struggle can actually tear the lungs. So they are tearing their own lungs in that violent struggle to get a breath of air. That's how these lacerations or these tears occur. And they're very challenging because, like any wound, you don't want to have the wound moving when you are trying to have it heal. And if you're breathing, you're obviously moving. And so we want to try to minimize that. Okay, just quickly on to surgical implants. This is something that's done very rarely, but it's done. This is one patient here, and others have been done too, subsequent to her. But in certain patients that cannot be released because of a functional problem, that in this case, this patient was struck by a boat across her spine, and she was paralyzed and so forth. And so she healed in the wild in a malformed way. All of her organs kind of were twisted around and so forth. So she was deemed non-releasable. So what we came up with was a way to mimic this external weight that I talked about earlier, and make it permanent. So we designed a permanent weight to implant into her in the exact same spot where this external weight is, just internal to her. And this is the surgery. It's going in. This is her head here. This is her backside, and this is the actual weight inside her, okay? So this is the implant inside the animal, and that will stay with her permanently. There was a lot of things around this procedure that planning wise and post-operatively and so forth that we won't get into here because of time and so forth. But this is just a glimpse of what can be done, even with the very extreme cases of animals that cannot be released because of functional issues. There are ways to get around that by thinking creatively, and this is just one of those ways. Okay. So now we talked about kind of the advanced teaching hospital part of the Sea Turtle University model, and I showed you kind of the disease classes we see and some of the approaches that we're using that is more precision-based medicine approaches. The second part of a university model is research, and it's a huge part. It's a huge part of what we do as a charity. Our sea turtle biologists kind of department has been doing population research from the inception of the charity, and we have a very comprehensive program in that regard. But what we are doing now is a clinical research effort, and that means research with patients to elucidate disease processes, to figure out what mediates their health, especially with olive Ridleys, because no one really gets a chance to study them. And as I mentioned before, we have this unique opportunity to study them. So our integrative research program, the goal is to establish a sea turtle health program. What is normal? We don't even know what normal is. So we're using the blood machine, for example, and all of the other machines, all that fancy stuff that we talked about, to determine what is normal. And then when we have what is normal, we can also assess what is abnormal. And then when we have the difference between the two, we can measure outcomes via different types of interventions. So if we do this therapy, does it work better than if we do this therapy? Because now we know what normal is, and now we know what abnormal is. And that's how medicine works. It just hasn't been able to be done in these species because no one has had an opportunity to study them this closely. And so we're very fortunate to be able to do that. This sea turtle health program is initially funded by a very nice multi-year grant from the Morris Animal Foundation, which is a wonderful organization that is just committed to animal health around the world. And so they've given us a great grant to move forward with a number of things. I'm a big gut guy. I did graduate work with the microbiome of the gut, and so we're going to study that too, because the gut microbiome, like in all species, mediates an enormous number of health processes. And so we are just at the very beginning with these species to figure out what the microbiome is for normal animals and for animals that are requiring therapy in our hospital. And that's how you sample it. You have to go up to into the colon, so the tail end. And this is just a graph of the microbiome of green and loggerhead sea turtles in a pilot project. And then finally, a university teaches, okay? And this is probably one of our very first and most developed aspects of that sea turtle university model that we are aspiring to, because we have a visiting veterinarian program. It's unique in the world. We're super proud of it, and it's evolving actually as we speak into a much kind of more formalized academic exercise where there's opportunities to participate in research. There's opportunities to kind of extend your stay for longer than a short period of time if you are a veterinarian that sees these species. We are also a founding member of the Sea Turtle Rescue Alliance, and that is the very first NGO that is dedicated to expanding access to medical care for sea turtles. And it's a wonderful organization. We're really proud to be part of it. And within that framework, we are hosting with them, the Sea Turtle Rescue Alliance, the very first regional veterinary training for sea turtles this year. And we're starting in the Philippines and Indonesia this year. And then next year, and on an annual basis, we will continue this intensive hands-on training that will kind of move around the world based on where our professional meeting moves, and we're coupled with that. And that will be in Thailand next year, early next year. Okay, so I know that's a lot of information, a lot of sea turtle medicine, a lot of sea turtle love, but this is where we are at and hope to be, and as we move forward into 2023 and onward. Just a quick shout out to all of our wonderful partners and collaborators that are depicted here. Too many to go through individually, but this really requires an enormous effort from everyone involved in sea turtle conservation world. And so we both, and all of us, in fact, from Olive Ridley Project, thank you for chiming in with us today. So we'll take, I think, some questions if we have time. Claire, do you want to?
Yeah, thank you, Dr. Max. That was a very, again, whistle-stop tour of the sort of things that we do see and treat at the rescue centre with the equipment that we have. So we have got a few questions, and if you're okay, I think I'll ask them, and hopefully between the both of us we can answer a few. So we've got a question from Leonor, like, what about sea turtles who swallow fishing hooks? So yes, we do see fishing hooks, and obviously we have the X-ray machine that helps us to locate those. and we remove them wherever it's possible. Obviously, there are certain easier surgeries, like if it's sort of within the neck area, but they can obviously go through all the way. So, Max, any other kind of comments about fishing hooks and our equipment?
Yeah, they you find them everywhere. They, usually like juveniles and stuff will get involved opportunistically because they're near fishing piers and things like that, and it can be dangerous. It can be. It depends where they're located. It can be dangerous, but you try to take them out non-surgically at first, and if you can't do that, you have to go in surgically. And so we definitely see them. Unfortunately, not just hooks, but foreign bodies in general. That's just one. That's a name for the general concept of foreign bodies, something that shouldn't be inside. Yeah.
Perfect. And then for yes, this is a big question. Do you have any turtles that cannot be released into the wild for any reason? And also, just a caveat to that is, so thinking of bubble butt, for example, and also, do we have cases of FP? So yeah, Max, I think can chime in on that one.
Yeah. So the bubble butt syndrome is buoyancy disorder. For those, that's just an older term, bubble butt syndrome. So yeah, we have animals. There are animals that are non-releasable, and there are different ways to approach dealing with that when it comes to buoyancy disorder. What I described to you, all of those modalities available, if you can use them. You can use them also. In my mind, there are very few that can truly not ever be released. There are some cases for sure, but that number of cases is dwindling because we have newer things available for us to try. Again, it's on a case-by-case basis, and it's difficult to answer just as a general rule. So I'll leave it like that. That we kind of think outside the box very much, and we're very creative in our approaches. But you have to balance that with what is in the best interest of the animal, and that in your decision tree. That's always first. What is in the best interest, of the welfare of that patient? FP, we don't have FP in our waters yet. Yeah. I'm saying, so in every other place I've practiced sea turtle medicine in the world, where they started without FP came, and we're in the process of publishing a paper about photo ID. Populations off of the coast of Kenya, and within that population are identification of FP lesions on certain groups of those animals. So those waters are not very far away from the Maldives, Kenya, that is. So for me, it's just a question of when we're going to see it. But again, those are green sea turtles, typically, not olive Ridleys. So.
Yeah. So I guess this is a kind of question regarding the centesis earlier. So obviously, if there's a patent tear, it's asking how do you fix that buoyancy issue. So like you mentioned, obviously we've got the blood patches, but is it like a one-off centesis? Are certain turtles more effective than others, and obviously differences in species?
Yeah, that's a great question, and it's a comprehensive question that requires a comprehensive answer that I can't get into too much in that regard now. But what I talked about is all of those things. Some of them will respond well to centesis, some will not. Some will respond well to blood patches, some will not. And again, the same with targeted external weight therapy. So each animal has to have an individualized treatment plan. It's very important because the way they approach their environment is individual. So we don't have a standard protocol. This is what we apply for all patients that come in with gas in their coelomic cavity. We have to really go kind of very customized, specialized treatment plans that modify over time too. Some animals will perform very poorly at the beginning, and all of a sudden, boom, they're doing fine within a week. Some start great and then deteriorate. So it's all very much a fluid thing that we have to customize, but we use all of those kind of all of the time. I hope that answers your question.
We've got quite a few. I'm going to make a note of many of the questions, and so we can get back to them if we don't get a chance to answer them in the next couple of minutes. We've got one more regarding the vitamin B12. Can you explain why we use that as injected into acupuncture sites as opposed to other medicines?
Yeah, that's a great question. So that's a clinician preference. That's our preference. Other clinicians use vitamin K. So what you want to do is not use the B12 necessarily for therapy because of the components of that vitamin. What it does is it irritates that acupuncture point in a way that makes the response to that irritation therapeutic. So you can use, some people use just water, fresh water, sterile water to inject. So it's clinician preference. So it's not really what you're putting into it, it's the response of the tissue to that introduction of that foreign substance, and most importantly, in the right acupuncture point. So that's what's happening. It's not so much the B12, it's that I'm doing it at that site and it irritates that acupuncture point, and I get the therapeutic response I'm looking for.
I'd like to recognise a few questions that we will answer on the comments below on Facebook, and that is regarding post-release rehabilitation. So Hamed's asked if we use any sea cages, for example, which we will discuss, and that's something that in the future we're hoping to actually have for our patients before they are released. Obviously, we have the satellite tag now to monitor the ones that are released when they are ready to go. Want to recognise, and we will talk more about wound care. So turtles, when they have open wounds, how do we bandage them? Do we bandage them? What sort of wound care do we do? I can quickly say, yes, we do use honey. That was one option of wound care that we do use. And I will answer those questions regarding, and so will Max, a little bit more details. Two things I want to bring up with Max. I think it's quite important that we talk about it. One is fracture repair, and do we use internal pins and fixation devices for flippers? So I think you can quickly answer that. And then finally,
we have tried it. It's very unrewarding as an understatement.
There we go. That was an easy answer. And then osteoarthritis and olives. I think we're very passionate about this particular topic. So Max, do you want to give us a 1-minute overview on osteoarthritis?
Yeah, OM is a problem. OM is a problem with these species and in these waters, and we're trying to get to the bottom of it. And so what we're doing now is we're beginning a study to actually take tissue biopsies of diseased animals and work with very experienced veterinary pathologists to try to elucidate first, what is the pathogen, the group of pathogens that are causing this disease potentially, and more importantly, why is the animal's response so different than other sea turtle species? So all of Ridley's respond to OM differently in terms of treatment and in terms of presentation than say greens or loggerheads, or they're more closely with Kemps that are cold stunned, for example, but still that's different. So it's a very confusing thing, and it's very frustrating for us as their doctors when we have bone disease, because bone disease is super hard to treat. So we want to figure out can we do something at the very beginning of that or during the process to get a handle on that disease. We can go on. This could be a lecture for 2 hours on OM and these species. Obviously, we don't have that time, but yeah, we're super passionate about it and quite irritated by it, actually, because we want to fix it. We see it a lot. Yeah, we see it a lot. Yeah.
We've got some brilliant questions. Like I said, we are going to answer all of them, and we'll get back to them on our Facebook page, and we'll write them out for you. And I think you've actually inspired us for some more veterinary talks moving forward, some of the questions that we've received. So I think on that note, would like to say thank you very much for listening. I know it's just gone over the hour. Thank you, Dr. Max, for going through the clinical work that we are currently doing, and also the forward exciting plans that we have for the Olive Ridley Project veterinary team. So I think on behalf of the entire veterinary team and the Olive Ridley Project, thank you for following us. And yeah, feel free to send any questions to us directly and we'll get back to you. So thank you, Dr. Max.
Thanks, Claire. Thanks, everyone. Have a great evening or morning, wherever you are.